Assalamu alaikum. Good evening, everyone. And I very appreciate this opportunity of welcoming you all to the 10th scientific webinar organized by Oman Pharmaceutical Society. As the previous session, I would like to remind you that the guest speaker will answer any questions from the audience at the end of the lecture. So if you have any question, please don't hesitate to type your question on the Q&A buttons or the question and answer buttons on the screen of the phone. Today's guest lecture is titled Masthenia Gravis, and we would like to welcome our guest speaker, pharmacist Maria Alawi. Pharmacist Maria graduated from National University of Science and Technology with BSc in 2017. She worked for a private hospital in a community pharmacy for almost 1 year and a half. And currently she's working in Khawla Hospital as a hospital pharmacist. Maria is much interested in medical research and public awareness. She has been an active participant in many seminars, workshops, and symposium, and she participated as poster presenter as well as a speaker. We welcome Maria, and Maria, the mic is yours.
Thank you so much, Dr. Mona, for your lovely introduction. Good evening, everyone. I am pharmacist Maria Alawi. So, as Dr. Mona told, our talk today is about Myasthenia Gravis. So, what you should know about Myasthenia Gravis, the outline of our talk today. First, we will have an overview about Myasthenia Gravis, then what is the causes of this disease, then the symptoms, complication, the diagnosis tools that they use to diagnose this disease, and finally, the treatment. First of all, what is Myasthenia Gravis? It simply is an autoimmune disease, and basically is what is there's a breakdown in the connection between the nerves and the muscles. And this breakdown of the connection between nerve and the muscles will lead to reduce the contraction of the muscles, and this will lead to the weakness and rapid fatigue of any of the muscles that under voluntary control. So this is simply what is Myasthenia Gravis. Now, what are the main causes of this disease? First of all, the antibodies, thymus gland, and there's other causes. We will go in details in each one of them. First of all, if we see here, the normal neuromuscular junction, this is for the normal person, and this is in Myasthenia Gravis patient. The normal neuromuscular junction, usually we have here a neurotransmitter. These neurons, the acetylcholine, once it releases, it will bind to the acetylcholine receptor. That will lead to contraction of the muscles. But in Myasthenia Gravis patients, their immune system will produce an antibodies. These antibodies will bind to the acetylcholine receptors that will lead to reduce the contraction of the muscles. Also, one of the causes is thymus gland. Now, thymus gland, as we know, it's a part of the immune system, and some researchers, they believe that these thymus gland, they can trigger or maintain the protection of the antibodies that can block the acetylcholine too. Now, also antibodies can also block the function of a protein called muscle specific receptor tyrosine kinase. Now, this protein is involved in the forming of the nerve muscular junction. So these antibodies that block this protein can lead also to Myasthenia Gravis. Also, some people, they have Myasthenia Gravis that is caused by antibodies that is blocking by they don't have, some people, their Myasthenia Gravis is not because of the antibodies. No, it's not because of the antibodies, or the muscle-specific receptor tyrosine kinase. So this is recorded as antibody-negative Myasthenia gravis, not because of the antibodies. Now, we have to know that also it's not that much common. Mothers with Myasthenia gravis have a child who will be born with Myasthenia gravis. But in case if there's a child born with that, this we call it as a neonatal Myasthenia gravis. And if it's treated properly, these children generally recover within 2 months after birth. Now, some children, they are born with a rarer or inherited form of myasthenia. This is recorded as congenital myasthenic syndrome. Now, I would like to ask you a question. What do you think? Myasthenia gravis is more common with women or men? So we will have this question. So I would like you to answer. You have 10 seconds to give us your answers. So now we would show the answers. We would see females, 82%, they said it's with females. Good. So I think you know about it. Now, so Myasthenia gravis, as you told, women are overrepresented the most number of Myasthenia gravis cases. They make up over 60% of Myasthenia gravis patients, and women are more often affected at younger age. And the height incidence of women usually from 20s to 30s, so it's very young age. But if we compare it to men, they are infected after 15 years old. Now, if we go to the symptoms of this disease, first we have, it can affect the eye muscles, it can affect the face and throat muscles, neck and limb muscles also can get affected. Now, the eye muscles, we have something dropping of the one or both of the eyelids that we call as ptosis. So as you see here in the picture, we have this is ptosis in a child, and this is ptosis in an adult. And you can identify these patients from their eyes when most of them, the symptoms or these eye muscles get affected and they have ptosis. Also, double vision can be vertical or horizontal. And some of them, they can relieve from this kind of symptoms by closing one of the eyes. Also, face and throat muscles. Now, once the Myasthenia gravis affect the face and throat muscles, patient will have a difficulty even in speaking. And it will cause also difficulty in swallowing, chewing the food. So if the patient, he faces one of these symptoms, sometimes he needs to take his food in a liquid form. Also, there is a change in facial expression. Most of the patients, even they cannot smile. Now, if we talk about the clinical profile of Myasthenia gravis in Sultanate of Oman, to be honest, we don't have that much data or research paper that published about this topic. But I found this study. This study is done in SQH. They follow up of 50 patients of Myasthenia gravis. Now, these patients, they referred from to the SQH, and they took a period from 1997 to 2000. So for 3 years, they follow up these 50 patients. Now, what they found out that the mean age was 27 years old, and it's ranged from 5 to 63 years. And they found that the ratio of male to female was 2 to 3. And there's 44 patient has generalized symptoms, and the facial weakness were present in 40 of these patients. Also, the ocular motor symptoms like ptosis, diplopia are the initial symptoms in 2/3 of the patient. And that is noticed also, most of the patients, they have these kind of the symptoms. Almost all have these symptoms after 2 years from the day of the diagnosis, and there was worsening of myasthenic symptoms in only 1 out of 8 pregnancies and deliveries, which is good. But as I told you earlier, we don't have that much enough data recently. This study was done only 20 years back. So I think if they did the study again, maybe the result will be different. The complications, myasthenia gravis is one of the life-threatening complication or condition that may occur to the myasthenia gravis patients, where the breathing muscles get affected. So if they get affected, the patient, once he get affected, he may need help and goes to the hospital, and he need to be treated immediately. One of the also complication time is gland tumors. Some people with myasthenia gravis have a tumor in their thymus. This tumor is not cancer type of tumor that we call thymomas, and it can be also removed to reduce the symptoms. Other disorders that like underreactive or overreactive thyroid, and we have autoimmune condition like rheumatoid arthritis also. Now, the diagnosis, how they diagnose these patients, we have neurological examination that done by the neurologist. We have the eyes package tests that they check the drop of the eyelid. And we have blood analysis where they check the antibodies, and repetitive nerve stimulation. Now, repetitive nerve stimulation, we call it as nerve conduction study. This type of diagnosis, what they do, basically they check the signals by the electricity in the electrolytes. So they check if there's any signals between the nerve and the muscles. We have the imaging like CT scan, MRI, that they check if there's any enlargement of the thymus or the thyroid. And we have pulmonary function test to check the breathing. Now, if we go to the treatment, here we have to understand that the treatment, it can be one medicine or it can be in combination, but also we have to tell the patients that these medications, they are not the cure of the disease. Only we are trying to improve his symptoms, and at least we make him live a normal life. So the treatment depends on many things. One of the things, the age of the patient, the progressing of the disease, the severity of the disease, and also the patient compliance to the disease, to the medication, sorry. So if the patient, he is taking his medication regularly and he follow the doctor orders, all these will affect the treatment of the patient. Now, what are the medications that being used? We have corticosteroid inhibitors, cortisteroid, and immunosuppressant. Now, corticosteroid inhibitors, we have bioistigmine and the neostigmine. Now, these two drugs, they enhance the communication between the nerves and the muscles. And as I said earlier, it's not to treat the disease, it's only to reduce the patient's symptoms. Now, they have a possible side effect like gastrointestinal upset, diarrhea, nausea, and excessive salivation and sweating. If in case patient he get any of these side effects, he should tell his pharmacist immediately. Now, bioistigmine is considered one of the drugs that is used mostly for most of the patients. So here there is a study treatment of Myasthenia Gravis focus on the bioistigmine. Now, in this study, they found out that bioistigmine has been used as a treatment of Myasthenia Gravis for over 50 years. So, and it's considered generally safe. And up to now, they are still using this medication. But we have to know that it is suitable as long-term treatment in a patient with generalized or non-progressive mild disease. So in case if patient he has his disease in severe cases and more progressive, in this case, we can use Bioistigmine, but in combination with other immunotherapy. Now, the cortisteroids, as we all know, like prednisone, they work by inhibiting the immune system, and they limit the protection of the antibodies. So most of us that these cortisteroids along with many side effects, osteoporosis, that bone thinning. Also, there is weight gain, diabetes, and increase the risk of some kind of infections. We have immunosuppressant, two immunosuppressant, I will call that azithromycin and methotrexate. These two, they are the common ones that is used in Khawla Hospital. And these drugs, which take their problem, these drugs, they take time. We cannot depend on them to relieve patient symptoms because they take long time until they work. So in these cases, they are not given alone, they give with Bioistigmine or with cortisteroids. Now, there are side effects of these immunosuppressants. They can increase the risk of infection, liver and kidney damage, and sometimes it can be serious in some patients. Also, we have to know that this kind of medication, they are cytotoxic, especially the azathioprine. We have to counsel the patients while taking this medication. He should be careful while handling this medicine because it can be absorbed throughout the skin. And also, if in case a patient, the person who is taking care of him was a lady, so if in case she's pregnant or anything, she should not handle this drug. Now, the intravenous therapy, we have the intravenous immunoglobulin. Basically, we are giving antibodies, normal antibodies. So these normal antibodies will try to change the immune system response and enhance the patient response and also reduce his symptoms. We have monoclonal antibodies like rituximab. This is also used for Myasthenia Gravis patient. Now, surgery, some people with Myasthenia Gravis have, as we told earlier, they have a tumor in their thymus gland. So that we call thymoma. So we have to remove the thymus gland. This is one of the options if the patient, he has a tumor in his thymus gland. Now we have Myasthenia Gravis alert card. This is simply is a table. There is another table, but I took this one only to take an example. Now we are usually giving to the patient. We print it and we are giving to our patients. So in case he goes to any health center, any hospital, they should know that they are Myasthenia Gravis patients and the drugs that can affect these patients. So as you see here, if you have 1 star, like in case of beta blocker, atenolol, and these, that indicates that this agent with documented effect in Myasthenia Gravis patient and should be used with caution with these patients. If we have 2 stars, it means like ciprofloxacin is associated with more common or more severe adverse event. In case there is no star, that is associated with less common or less severe adverse event. These are the reference that I used. So by the end of this talk, I would like to tell you that your life is likely someone else's dream. Don't be ungrateful. Now, these Myasthenia Gravis patients, they want to at least swallow their food or to have a simple smile. So we should be grateful to what we have. And thank you so much for your attending and listening. Back to you, Dr. Mona.
Thank you, Pharmacist Maria. Thank you for this well-presented and informative interesting now to the question and answer session. So before we going to answer your questions by Pharmacist Maria, I would like to inform you that these seminars and webinars was of great success in the previous sessions that has been conducted already. So the Oman Pharmaceutical Society will continue conducting more online webinars at the time. Just follow us in the Twitter and Instagram accounts, which is at to be informed about the new coming sessions and webinars. We will also like to invite you if you would like to share your knowledge and experience and to be one of our guest speakers in the coming webinars as well. Pharmacist Maria, if you are ready, we can have almost like 10 minutes of answering the audience questions. Yes.
There is one question. It is reversible or irreversible disease? I don't know what you mean, if reversible or irreversible disease. If you can give more explanation. There is another question. I heard that most of the females diagnosed with Myasthenia Gravis, usually they have other diseases like diabetic mellitus. I cannot tell that most of the patients that I dealt with, but I think if we check the lectures and other research, they didn't mention also that, so I don't. I think we finished.
Okay.
Or there is one. No.
I think the audience meant if reversible or reversible, if you will treat it, will the condition will be reversed, like the,
as I told earlier,
the damage that happened on the patients, on the nerves.
We are trying only to reduce patient symptoms. So we are reversing the symptoms. And at least we are trying to make the patient live his normal life. That's the only thing they can do with these patients, because eventually it's an autoimmune disease, so we cannot do anything.
Okay. Thank you, Maria. Thank you for answering the audience question. I hope we answered your question as well. We are like 5 minutes before the end of the session, but we would like to thank all our audience for attending. We reached to the end of the webinar. Again, we will thank you, Maria. Thank you, the audience. And please be updated and follow us in the society accounts on the Instagram and Twitter to be updated with the new coming sessions. Thank you for your time and stay home and stay safe.